Everyone, I will describe you the anatomical position, attachment, and relations of typical ribs, typical thoracic ribs. Let's start. This is a typical thoracic rib of right side. It is in anatomical position. This is the anatomical position. It has three parts: anterior end, posterior ends, and intervening shaft. The anterior end is downward, forward, and lateral. The posterior end is upward, backward, and near to the medial plane. The anterior end has a concave depression for the articulation with costal cartilage. The posterior end has three parts also: head, neck, and tubercle. The head has two facets: upper facet, lower facet. The lower larger facet articulates with the upper larger facet of numerically corresponding vertebra. The upper smaller facet articulates with the lower smaller facet of the vertebra above, and a crest between two facets articulates with the intervertebral disc between two vertebrae. Then comes to neck. It there is also two ligaments in head, upper in radiate ligament and capsular ligament. Then comes to neck. It has two surface: anterior surface, posterior surface, and two border: upper border, lower border. Then comes to tubercle. The tubercle has two facets also: medial articular facet and lateral non-articular facet. The medial articular facet articulates with the facet on transverse process of numerically corresponding vertebra, and the lateral non-articular facet provides a ligament. This is called costo-transverse ligament. Then there is an angle near to the tubercle. Then it comes to shaft. The shaft has the shaft is twisted and curved. The shaft has two border: upper border, lower border, two surface: outer surface, inner surface. Um, in the inner in the inner border, lower border. In the lower border, there is a costal group. It is the most important feature of ribs. The coastal group is consists of three parts: upper lip, in the middle, floor, and lower lip. There is some attachments in external, internal, and innermost intercostal muscles. There are also some relations also: intercostal vein, intercostal artery, and intercostal nerve. And the most important thing is that in anatomical position, the two end is not exist horizontally. The anterior end is slightly downward, and the posterior end is slightly upward, and they are not in the same level. This is the description of thoracic ribs, typical thoracic ribs. Thank you.